The following portion of KTAB for You is sponsored by Maichel Retirement Solutions.
Well, coming up here soon, effective August 1st, some big network changes are coming for Medicare Advantage beneficiaries here in the big country. But Breanna Maichel from Maichel Retirement Solutions is here to help us answer some questions and hopefully ease some fears about what's going on. So I know some big changes are happening. It's just, coming up very soon here in about a week. So tell me, what kind of changes are happening?
So the biggest change that we're seeing, and really the main change that's happening August 1st, is we are seeing one of the large Medicare Advantage plan networks be taken away from our hospital system here in Abilene. They don't want to network with any Medicare Advantage plans from this point forward, and that contract expires for the last big guy on August 1st. Last year, we saw two of the big leaders in Medicare Advantage that were dropped from that Hendrick Health System hospital network. And then this year is the last man standing. So without saying any names, many of those beneficiaries know exactly what I'm talking about. But yes, they have made that decision that they don't want to network with those Medicare Advantage plans anymore. You will still be accepted at the hospital and they will take that health insurance, but it will be out of network at the hospital.
And of course, that would come at a bigger cost when it's out of network. So what kind of options do people have? Like, how can people speak up and speak out against what's happening?
So what I would suggest is going to your state and local representatives. You can advocate for yourself. My parents growing up, they always said the squeaky wheel gets the grease, make your voice heard. I myself have contacted our state and local reps. Stan Lambert here is pretty active in Abilene. I would suggest contacting him. He's also on the board at Hendrick Hospital. So if you're not happy with the decisions that your hospital system is making, I highly recommend, taking action. We've also started a petition on change.org to stop them from removing those networks from the hospital because honestly, it definitely could have more long-term effects than even just the short-term, my coverage is going to maybe cost me more at the hospital when I use my benefits. CMS, which is the Centers of Medicare and Medicaid, they actually have to see in-network suitability in order for these plans to renew in our counties. And so by the hospital saying we're not going to take any Medicare Advantage plan networks, we're not going to be in network with any of these plans, it's very likely that in the future, in the long run, CMS could ultimately come out and say, well, you don't have in-network suitability. You can't renew that plan. And last year, we saw two of those big carriers go out of Taylor County, and a lot of people lost their health plan and moved to this last man standing. So it really could have more long-term effect as well as the obviously immediate effect of paying higher costs at the hospital.
What can people do in the meantime to avoid those higher costs? What kind of options do we have?
So in order to avoid higher costs, one of the big things is hospital indemnity plans. We talk to a lot of our Medicare Advantage beneficiaries about choosing a hospital indemnity plan. And what that does is if you do end up in the hospital, it pays you a benefit so that you can substantiate paying those additional hospital costs that you're accruing in those times. And those hospital indemnity plans, we can make them match your Medicare Advantage plan. And so we usually recommend to our Medicare Advantage beneficiaries that they should think about having that hospital indemnity. And that would definitely help to cut down on their cost when they do accrue those out-of-network charges.
So can people make changes to their Medicare plan at this point in the year to avoid, higher costs or anything like that?
Typically, we tell people, you're locked into your health plan for the calendar year. You can only make changes during that annual enrollment, which is right around the corner, starts on October 15th, and it runs through December 7th. However, beneficiaries may have special election periods outside of that enrollment that would allow them to make a change. So we always suggest, contact your local agent or contact us, and we're happy to see if there is an election period that you might qualify for to make a change to your plan in order to, avoid some of those higher costs.
We're sitting here talking and we could go on and there's only so much time. So if someone wants to contact you and get that help, how can they go about doing that?
So the easiest way to get in touch with us is just to pick up the phone and call us. We'll get you on the calendar right away. You can also go to our website and there's a link on there to schedule. And by the way, if you do want to sign that petition, we'll have a link on our website. It says take action, go directly to the petition. You can sign that petition and hopefully get Hendrick to hear us and make a change to that decision that they've made. But And then lastly, you can also come to one of our Medicare seminars, and we do that once a month at the library. And of course, our services are of no cost to the beneficiary.
That's just great that you offer this free help out there, because I know people are worried about their healthcare costs going up. So it's great to have that free help out there, both at your office and at those free seminars at the library. So thank you so much for coming here and helping to ease some of those concerns. I've seen the viewer emails, and I know people are worried about this. So thank you for being out there and helping people for this.
Yes, of course. And thank you so much for having me.
If you would like to contact Maichel Retirement Solutions, they are located at 2500 South Willis Street in Suite 200. They are open Monday through Thursday from 9 a.m. to 5 p.m. and Fridays from 9 a.m. to noon. You can give them a call at 325-252-4177 or go online to MaichelRetirementSolutions.com. Maichel is spelled M-A-I-C-H-E-L, retirementsolutions.com. And be sure to come out for their free Medicare classes every month at the Abilene Public Library South Branch in the Mall of Abilene. They are available the first Thursday of every month at noon. We'll have all those details on our website, bigcountryhomepage.com.
The preceding portion of KTAB for You is sponsored by Maichel Retirement Solutions.